Inside this 140-year-old prison, the cells don't have doors, ventilation is poor, and it's hard to isolate infected inmates.
This is human beings in a closed environment, and they're sharing everything from a general food source to a general source for their toiletries.
Nearly half of the 774 inmates at Stony Mountain have tested positive for COVID-19, and now one has died.
Once it's in there, it's in there. It's going to run its course. We have to do everything we can to stop and slow the spread. And that's what we're doing right now.
The inmate's name has not been released. CBC News has confirmed he was in his late 60s and died on December 27th after nearly 3 weeks in one of Winnipeg's acute care hospitals. The Federal Training Centre in Quebec and Mission Institution in BC have also each recorded one death. This spring, a specialized mobile medical unit was sent to house sick mission inmates. Advocates say that and temporary housing could prevent facility-wide lockdowns and solitary confinement.
A lot of the prisoners who test positive are put in what we would formally have described as the hole, or solitary confinement, or segregation. So they perceive it as a form of punishment, which makes them a little hesitant to even report symptoms, which is not good, which means that they could be spreading it on the range.
The federal government's response to the COVID-19 pandemic.
This expert believes the infection and death rate in prisons is higher than official statistics and worries it will only get worse.
There should be very real concerns about not just the accuracy for the sake of knowing how many prisoners have died, but that the fact that people are coming back into the community.
The Correctional Service of Canada says it's keeping a close eye on Stony Mountain and other federal institutions, saying infection prevention measures are in place to protect inmates and staff. Karen Pauls, CBC News, Winnipeg.